to address this body to share St. Kitts and Nevis' situation and response to the COVID-19 pandemic. On March 25, 2020, we recorded our first case. Currently, there are 15 confirmed cases with no community transmission. 14 persons have recovered. There are no hospitalizations or deaths. This is a remarkable achievement for a small state in the Western Hemisphere. Our achievement can be attributed to its rigorous public health response and an all-sectors approach with requisite legislation and regulations to guide our response. Early closure of our borders, scrupulous social distancing, meticulous respiratory and hand hygiene practices, and heightened public education awareness programs were key strategies used to contain the spread. Our national response included recapitalization of our health facilities in terms of equipment through a medical arrangement with Cuba, and training of all frontline personnel in health, business, and national security. Our healthcare system also benefited immensely from the support of the international health agencies such as Pan American Health Organization, PAHO, and the Caribbean Health Agency, CARPHA. Our success in addressing COVID-19 is due in part to our relationship with Taiwan, who has donated considerable sums of PPE in addition to providing early expert review of our national pandemic response plans. Taiwan's own success story stands out for commendation. Just 440 confirmed cases with a minimal community spread in a population of 23 million people. There's much to be learned from Taiwan's handling of the pandemic. As has been done consistently over the years, our country again makes an appeal for Taiwan to be granted full membership status in the WHO. Taiwan has made significant contributions to the world: knowledge and technology transfer, mastery of universal health coverage, and disaster response and mitigation. Mr. President, global success in winning the war against COVID-19 will be largely dependent on strong leadership at all levels: government, the private sector, and civil society. The focus must be on saving lives, safe vaccine development, and recalibration towards a new normal that includes the right to health and life and the dignity for all people. I thank you.
I thank you, Honorable Minister. We would invite Senegal to be followed by Zambia. Senegal, you have the floor. Very well, we don't seem to have Senegal online. We would move to Zambia, followed by Georgia. Zambia, you have the floor. Zambia. We would move on to Georgia, followed by Vanuatu. Georgia, you have the floor, please. We understand Georgia is not available. Could we now move to Vanuatu, followed by Uganda? Do we have Georgia online? Okay. Okay, we will go with Vanuatu. We don't seem to have Vanuatu. We will go with Uganda. Honorable Minister, you have the floor. There is no response from the Honorable Minister from Uganda. Could we proceed with Iraq and then Comoros?
أصحاب السعادة المحترمون السيد مدير عام منظمة الصحة العالمية المحترم بالرغم من
Mr. Director General, in spite of the challenges facing Iraq in terms of security, resources and the shortages in health care workers, we were able to confront COVID-19 and were able to involve all sectors. Iraq, since the beginning of the first signs of the crisis, has taken preemptive measures to record all cases. Public gatherings were prohibited, restaurants, cafes and bars were closed, which has enabled us to conserve the capabilities we have within the health sector. Since the beginning of the crisis, we were able to record more than 3,500 cases, and we were able to keep death cases at bay. However, the consequences and the impact have varied on the economic and social sectors. We continue to work under the umbrella of the United Nations and the World Health Organization to make sure that we benefit from the technologies available.
Comoros to be followed by Kiribati. Comoros, you have the floor. We understand Comoros is unable to make a statement. Could we now invite Kiribati, followed by Malawi? Kiribati, you have the floor, please. We don't seem to have Kiribati online. Could we invite Malawi? You have the floor. Unfortunately, we don't have Malawi. Could I now invite Solomon Islands to be followed by Sudan? You have the floor, Solomon Islands. We will proceed to Sudan, followed by the Democratic Republic of Congo. Sudan, you have the floor, please. Very well. We would go with Democratic Republic of Congo to be followed by Pakistan. DRC, you have the floor, please. We don't have Democratic Republic of Congo. Could we now invite again Pakistan to be followed by the Emirates? Pakistan, you have the floor, please.
coordinated, collective, and sustained action among countries and institutions to suppress and mitigate this pandemic. It is clear that no country alone can protect itself from this contagion. Solidarity and unity is therefore vital to tackle morbidity and mortality, to ease burden on the health systems and support national and global economies. Pakistan endorses the statement delivered by the Chinese delegation on the issue of Taiwan. Pakistan fully supports China's efforts to safeguard its sovereignty and territorial integrity. In line with iterations of general committee, year after year, Pakistan's position is that there is only one China and Taiwan is being an integral part of China. This session of the World Health Assembly is significant in many ways. As the premier global health parliament, it must lend its full support to the ongoing preparedness and response plans and strategies. The Assembly must support growing calls for development and production of COVID-19 related diagnostics, therapeutics, and vaccines that are affordable, equitable, and accessible to all. Our Prime Minister Imran Khan has already given this call for the people's vaccine. Pakistan has reported significantly lower numbers than the initial international projections, especially considering that Pakistan is the fifth largest populous developing country of the world. Despite these numbers, we are not complacent and are taking every possible step to combat this pandemic. We have started trace, test, and quarantine strategy, and we have also launched a We Care campaign for the protection and the support of our frontline health workers. Some of the lessons learned from the outbreak of this pandemic include the need for enhanced investments in national and global pandemic preparedness, detection, and response mechanisms, of core capacities under IHR, and improved pandemic response financing mechanisms. WHO and member states must take the opportunity to start imagining the future of healthcare in post-COVID-19 world. Current political global attention must translate into strengthened essential public health functions in all the countries. And more than ever before, world needs primary healthcare-based universal health coverage. The world is bearing the fallout of this pandemic in so many different ways, including the spread of other diseases, as those have remained relatively unattended over the last 3 months. And at the end, I want to emphasize the need for taking a human rights approach and a collective action for voiceless poor suffering through these tough times. I thank you very much, Mr. President, and I commend the WHO leadership in these tough times. Thank you very much.
Thank you, Honorable Minister. We will now invite the Minister from the UAE. You have the floor.
نيابة عن معالي وزير الصحة والرعاية.
On behalf of His Excellency the Minister, I take the opportunity to express my gratitude and thanks to the President of the 73rd WHA, and I would like to congratulate her on her election. I would like to thank Dr. Tedros and all members of the organization for their efforts in helping in confronting COVID-19. Your Excellencies, ladies and gentlemen, we're meeting at a time when COVID-19 is casting a gloomy shadow and makes it imperative on us to take unprecedented measures. In this regard, the United Arab Emirates has set up a comprehensive emergency system at all levels, led by the government, to respond to this crisis. The Ministry of Health has started more than 1.5 million PCR tests, and this represents one of the highest levels in the entire world, and we continue to conduct 50,000 tests on a daily level. And the most recent report by WHO shows that the United Arab Emirates ranks 9th in the preparedness for dealing with pandemics. We take great pride in having the city of Dubai as a center for warehousing for the provision of medical requirements all over the world. We take great pride in our partnerships and our cooperation with the organization, where we provide a lot of support materially and in kind, and we provide aircraft to transport these contributions. We continue to contribute to international efforts to ensure world security as far as health is concerned. Thank you.
Thank you very much, Honorable Minister. We understand Georgia is back online. Georgia, you have the floor, please.
Sehr geehrte Frau Präsidentin.
Honorable President, Honorable Director General, distinguished delegates, I would like to take this opportunity and thank you all for enormous efforts and solidarity in the fight against COVID-19. Starting from January, Georgian government has been taking drastic measures to contain the spread of COVID-19 by employing adequate social distancing measures, mobilizing healthcare facilities, and establishing fever response programs at primary care level. The key factor determining our success was rapid response and prevention. In particular, targeted testing, isolation, and treatment of all possible cases. Technological solutions enabled us to continue teaching at schools and universities and promote online working platforms. We have launched a special application for contact tracing to protect health of every citizen. 20% of our country is occupied. Unfortunately, that is why the central government of Georgia does not have full information about the epidemic situation in the occupied Abkhazia and Skhin Valley regions. The central government of Georgia, with support of UN agency and other international partners, is ready to provide assistance to its citizens in the occupied territories. The joint and highly coordinated actions of the government and relevant institutions enabled us to contain the infection and keep the virus positive cases minimum. The pandemic showed to us once again how important it is to strengthen capacity of primary care services, advance regulatory framework for adequate infection control, and expand our programs for immunization and chronic disease management in order to minimize devastating outcomes of comorbidities. Guidance provided by the WHO through the whole national response has been extremely helpful. We appreciate the opportunity to join the Solidarity Trial and will do our best to contribute towards joint efforts for finding COVID-related solutions. I thank you.
Thank you very much, Honorable Minister. May we now invite the Democratic Republic of Congo to take the floor. Honorable Minister, you have the floor, please.
La République démocratique du Congo.
The Democratic Republic of the Congo is pleased to take the floor on the occasion of the 73rd World Health Assembly, which is being held in unusual circumstances marked by the COVID-19 pandemic. The DRC would like to acknowledge the remarkable work performed by the WHO in supporting multiple countries, including mine, in their fight against this horrible disease. My country had its first case on March 10th, 2020, and since then, more than 1,500 cases were confirmed in that province and later in the country. In our response, despite the efforts deployed by my government and our partners, there are major challenges which remain when it comes to diagnosis, care, and surveillance. Also, my country is facing other challenges related to health which require attention from all stakeholders, including Ebola in the eastern part of the country, as well as rubella and polio. There are other diseases which are plaguing our country, but COVID-19 reminded us of how important it is to strengthen and enhance our healthcare system so that it can be resilient and we would be able to move towards universal health coverage. Hence, are stressing the need for international solidarity in order to face the realities in our country. This is why the Democratic Republic of the Congo would like to invite the WHO to work towards specific measures in order to ensure better efforts in order to prepare for world health emergencies, particularly in countries that recurrently face health emergencies, in order to allow for the necessary task teams and forces to carry out the necessary interventions. Thank you very much.
It's the request for the floor from our member states. We understand that a video has been received from the Order of the Malta, but it's not ready yet. We'll therefore move to our UN agencies and then come back to Malta when the video is ready, Madam President, if I may. So I'll proceed to call on the World Food Programme. You have the floor, followed by the IOM. World Food Programme, you have the floor, please. Okay, we will move to IOM.
Honourable Chair, Director General, delegates, in the face of COVID-19, the International Organization for Migration reiterates the need for inclusive approaches and calls on countries to combat stigma and address the specific vulnerabilities of migrants while recognizing them as key stakeholders themselves, whether as part of the health workforce fighting this pandemic or as contributors to future socio-economic recovery. As your committed partner on promoting the health of migrants, IOM continues to implement policy and operational measures on the human mobility dimensions of this pandemic, including migration communication campaigns, population mobility mapping, health capacity development at points of entry, and cross-border coordination, while ensuring continuity of care for essential services such as TB, malaria treatments, and routine immunization. Moving forward and respecting UHC principles and international solidarity, we must ensure that migrants, regardless of their legal status, have access to future therapeutics and vaccines, especially in low-resource settings. Thank you.
Thank you very much, IOM. We understand Order of Malta is ready. We will give you the floor, sir.
The Sovereign Order of Malta is contributing to the global response to the COVID-19 pandemic through its worldwide humanitarian action. It is of greatest importance to reaffirm here the necessity for the broadest possible international cooperation between all stakeholders. We wish to commend the WHO leadership in the fight against coronavirus. The vital role played by faith-based institutions in this emergency is being widely acknowledged. WHO recognizes that religious leaders face political instability, economic challenges, violence and conflicts to deal with the pandemic. The order has also scaled up its social services, distributing more food, water and medication to elderly, homeless, isolated, disabled and terminally ill persons. Psychological hotlines and on
Thank you, Madam. We will now move to the African Union Commission. You have the floor, to be followed by the Commonwealth Secretariat. Thank you. We would invite the Commonwealth to make their statement before the African Union. Commonwealth Secretariat, you have the floor, please.
COVID-19 threatens to set back progress towards our goals of achieving universal health coverage and the Sustainable Development Goals. The Commonwealth is mobilizing to tackle this pandemic and its far-reaching economic and social ramifications. Our health ministers last week held their first ever virtual meeting to share best practice and reaffirmed their commitment to a coordinated approach to ensure that none are left behind. I commend to this Assembly the Commonwealth Ministerial Statement issued on behalf of our 54 members, representing 1/3 of humanity. In accordance with the values and principles of the Commonwealth Charter, it commits us to solidarity and mutual support in responding to COVID-19 and the ensuing economic challenges, with continued attention to the needs of the most vulnerable in society and to tackling climate change. Our healthcare workers represent so much that is noble and best in humanity. Their shining example of professional dedication and selfless service should illuminate our thinking and the proceedings of this Assembly. This pandemic is affecting every aspect of our human existence, and to fight it, we need a whole-of-government approach. It brings home to us, as never before, the urgent need for multilateral action. I thank Dr. Tedros for his steadfast leadership of the global response through the WHO and pledge our Commonwealth support and continuing multilateral engagement to this fight.
Thank you, Madam. We will now invite the African Union Commission.
Assalamu alaikum wa rahmatullah. Of the chairperson of the African Union Commission, His Excellency Musa Faki Mohammed, and to extend his greetings to WHO and to the Director General of WHO, His Excellency Dr. Tedros Adhanom. Excellencies, the ongoing COVID-19 pandemic has reignited the need for global health solidarity and partnership in order to arrive at collective and decisive solutions that will advance global public health security and safety. They have endorsed our joint continental strategy on COVID-19, and also they have instructed the chairperson of the African Union Commission to establish the anti-COVID-19 response fund. Heads of states and governments, they decided to establish 3 coordinating committees, one for the Ministers of Health, another committee from the Ministers of Finance, a 3rd committee from the Ministers of Transportation. We must work hard to avoid our response to COVID-19 from halting progress towards ending the epidemics of HIV, TB, and malaria, as well as maternal, newborn, and child health, and reversing hard-won gains in mortality and infection rates. The Commission would also like to use the opportunity to express its appreciation to all health workers and allied personnel. We give condolences to those who lost, to the families of those who lost their lives on the front lines of combating and fighting COVID-19. Excellencies, thank you very much for listening.
Thank you very much, Excellency. Could I now invite South Center to take the floor, please?
Excelencias, señor.
Excellencies, delegates, it is an honor to address you on behalf of the South Center, an intergovernmental organization of developing countries, which is an observer here. I would like to focus on 3 specific messages, bearing in mind the time limits. First of all, we should consider all medications, vaccines, diagnostics, and instruments necessary to face this crisis as global public assets, as was recognized by the United Nations last April 24th. Secondly, this is the occasion to rethink this organization, to make it a public, independent organization which would use all of its means of pursuant to its constitution. And also, we need to carry out research so that this research will not only be guided by commercial interest, and it would be focused only on access. Thank you very much.
Thank you very much, Excellency. Madam President, we've exhausted the list of speakers. We do, however, understand that a member state has asked to speak. We would want to give the floor to the member state, Madagascar, and we'll conclude the consideration of our list. Madagascar, you have the floor, please.
Merci. Merci.
Thank you, Madam President, Director General, ladies and gentlemen, ministers, distinguished delegates. Allow me to congratulate Madam President and the members of your office for leading the work of the 73rd World Health Assembly. We would like to thank the Director General of WHO for his remarkable work and his leadership in improving health around the world, in Africa and in Madagascar. Elected to the Executive Board for 3 years, Madagascar would like to express its gratitude. Our vision with regard to the health policy is based on the principle monitor and intervene. It applies to any disease which has an epidemic potential, including COVID-19. This monitoring includes improving the capacity to detect, for early detection with an alert system with a rapid response possibility. Intervention is based on prevention and provision of treatment in cases. Therefore, an efficient and responsible partnership which is to the benefit of stakeholders should be developed and implemented. I welcome the technical support that WHO has provided to Madagascar. It is up to us to ensure that we can build capacity of our health staff and to ensure the operational health monitoring. Public health is part of the framework for globalization, which allows development of Madagascar. WHO, therefore, is a key partnership for Madagascar in its efforts to achieve the objective of universal health coverage. Thank you.
Thank you, Honorable Minister. Madam President, contrary to my earlier statement, it appears that we do have a few more countries who've taken the liberty to ask for the floor, if I may. Could we now give the floor to Burundi, to be followed by Guinea? Burundi, you have the floor, please. Okay. Could I now call on Serbia to take the floor, please?
Can you hear each other?
Yes, yes, we can hear you, Honorable Minister. Please proceed. Thank you.
Can you hear each other? Very good. Hello?
We can hear you. Please proceed.
Yeah. Dear Madam President, distinguished delegates, dear colleagues, ladies and gentlemen, we are all facing a difficult time. Cooperation with countries, exchanging knowledge and experience, as well as mutual assistance and support is perhaps most important at this moment. Do not let anyone think there are no cancer, or God forbid there are some enemies, but we all need to fight together against the pandemic caused by the COVID-19 virus. In that sense, we would like to emphasize that the Republic of Serbia has implemented decisive measures in combating and preventing the spread of the virus, representing all the recommendations of the WHO, the international organization, and respect other states' experiences. At all times, the government of the Republic of Serbia has taken care that all measures are justified and aim at saving the largest possible number of its citizens, lives of its citizens. We would like to express our gratitude to the People's Republic of China and the European Union, its member states, and the Russian Federation for their assistance, each in accordance with its capabilities. I'm deeply convinced that in time like this, it is important to leave the risks behind and to focus our energy in fighting the pandemic. The results of the Republic of Serbia in the fight against the virus would never have been so effective if it had not cooperated to exchange the experience with everyone. A joint fight against the pandemic based on the recommendation of the World Health Organization is the only way for us to succeed in defeating the virus. We need to show solidarity and strengthen multilateral cooperation in order to overcome the difficulties we all face together. In this regard, the need to suppress the pandemic actively should take precedence over any political issues and divisions. The answer to the pandemic should be global. No one should be left alone. I do not think only in small countries, but on the continent, even in EU, Italy or Spain, everyone should be taken care of. The Republic of Serbia, as a World Health Organization member state, is highly appreciative of the organization and is active contributor to its work, and firmly believes that any initiatives with the potential to give rise to politicization and divisions within the organization are not to the benefit of an efficient fulfillment of its primary role and mandate. The Republic of Serbia attaches special importance to the work and activities of international organizations in the UN system on the basis of full and consistent adherence to the Charter of the United Nations, norms and principles
Honorable Minister,
of national law, as well as the
Honorable Minister, we will be grateful if you could conclude your statement.
Okay, in this regard, the Republic of Serbia express full support to One China principle as well. Thank you.
Thank you very much, Honorable Minister, for your kind indulgence. We have Guinea-Bissau, and I believe I could yield the floor back to the President after Guinea-Bissau. Guinea-Bissau, you have the floor, please.
Ladies and gentlemen, we have proceeded our present at the 73rd session of the World Health Assembly. Faced with the COVID-19 pandemic, Guinea-Bissau not only joined global initiative under WHO directive, but internally adopted several among them. Restrictive measures, personal screening, social distance, and the mandatory use of masks. Created in an interministerial committee involving national and international non-governmental organizations and engaged community in the fight against COVID-19. Prepared an emergency plan to combat pandemic. Creation of quick response team is spread through the country. Provision of appropriate place for medical care and specialized medication include hospitalization in tent and hotel for COVID-19 patients. To date, according to the latest statistical data, the country has 900 cases, 990 cases, including 37 recovered, and 4 deaths in universe of 2.510 tests of a population of 7,100 inhabitants. Given the scale of pandemic and the fragility of our health system, WHO support was so crucial in the fight against the pandemic. In this context, the country more than ever needs support of WHO to improve the health system as a whole, implement the emergent plan to fight COVID-19 as well as provide urgently masks, rapid tests, lung ventilator, and other medical equipment to reduce the spread and stop the pandemic. To finalize, Republic of Guinea-Bissau and the Republic Popular of China is one and indivisible. Thank you very much for your kind attention. Thank you.
Thank you very much, Honorable Minister. We do understand that the video for the Order of Malta had a technical problem towards the end. We will request that we play that intervention again from where the disruption happened, if possible. If not, we'll play the full video once again. Full video of the Order for the Malta once again. Thank you very much, Madam President.